But yeah, we're looking this morning at the challenges, Naga, and good morning to you at home as well, of living with special needs and the challenges some of those families face. We're in the Normansfield Theatre, which is part of the Langdon Down Museum of Learning Disability here in Teddington. So it's about 10 miles away from central London, about 10 miles away from Parliament. And one of the things that people have been saying to us this morning, amongst the hundreds and thousands of comments that we've been getting about those challenges that many families face right across the UK, is it won't make a difference until people in Parliament listen. So can you put those questions and some of our comments to the ministers and those who make decisions? Well, delighted to say we're joined now on BBC Breakfast Live by the Care Minister, Caroline Dinenage. Thank you so much for coming on Breakfast and talking to us this morning. I know there's many things to solve, and I know many of our viewers and our guests here in the Normansfield Theatre this morning know this isn't an easy thing to fix. But one thing, Caroline, that really comes across is the frustration of thousands and thousands of people watching this programme this morning, particularly things like education, quality of life. They can't see a way out. They can't care for their loved ones because there are funding issues and many other issues related to that as well. What is your message to the many people, not just here this morning, but to the thousands watching and caring about their family this morning?
Well, first of all, good morning, and I'm really sorry I can't be with you there in person. I desperately wanted to be. I hope this will be second best to be down the line talking to you all. I totally get it. It's so actually brilliant that the BBC is shining a light on this, because as Care Minister, I don't get out much. You know, people will always want to talk about health, but actually care is one of the most fundamental things that that we can do for our population, and nobody should feel that they're disadvantaged by our health system, by our care system, by schools, by society, because they have a learning disability or autism, or because they're caring for somebody who does. And that's what I'm seeking to change. That's why I've been up and down the country meeting people, talking to people. But I think it's not a quick fix, as you say. Money will help, but money's not everything. What we really need is a culture change about how we approach people, how we make sure that everybody has the same opportunities in life, the same life chances, and the same quality services.
Which, Caroline, sounds amazing, but you know, some of the specific issues we've been talking about this morning, because you know what you say there sounds great, but the families we've been speaking to, they face an uphill struggle every single day to try and find that level of care which they need, not just that they want, but they need for their families as well. Let's look at secure unit beds, because that's something which I know the government have promised to close between 35% and 50% of those beds by March 2019, so only a few months left. How on earth are you going to meet that target? Because you're way off at the moment.
We are. We're on 20%, but I've always said that it's not about getting people out of those units for the sake of it and into a community where there aren't robust community services. So it's always been about investing in those community services and making sure that they're there before people come out of those units, because otherwise people will just go straight back in. So about 20% fewer people are there. Now, let's just not sort of get down the wrong track here. It's really important to recognise that for some people those are a really important service, they're a really important place. I've had parents that have written to me and said, you know, ATUs are being castigated in the media and in other places, but they saved my child's life, you know. So for some people they are absolutely important and urgent. But
Caroline, I'm sure many of our viewers will agree with you on that point. I know we've got limited time with you, so I'm trying to get as many questions as we can to you. But earlier we spoke to Jeremy. I know you know about Jeremy's case and his daughter Bethany, who's been in these ATUs. And she's been in a secure unit for many years, trying to find a way out of that. That for Jeremy's quality of life and for his family as well. And his point that he wanted to make to you was, take the £750,000 that it's costing to keep Bethany in that secure unit and use that on early intervention. Why
100%.
Can't we do things like that for not just Bethany, but many other people who are living in that situation?
No, I completely agree, 100%. You know, and the NHS long-term plan will be coming out soon. And for the first time ever, learning disability and autism are one of the key clinical priorities of it. That's never happened before, and I think that's a great step forward. And it will talk about things like transforming care, but it will also talk about things like community provision, early intervention, how we stop people ending up in these sort of units unnecessarily. Because in so many cases, they tell a story of a missed opportunity earlier on, especially in a young person's life, where the right support and help wasn't put in place at the right time.
And I think the other thing that really comes across, Caroline, from speaking to some of the families this morning and many of the messages we're getting today, is that there is a real feeling, and it's a frustration as well, that money is being spent in the wrong places. You look at the social care issue, which is paid for by local councils who've had their budgets halved since 2010. And there's like a separate pot of money for social care, and then hospital care is dealt with by the NHS. And until those two are married together, people who are challenged by living with special needs and other things like dementia as well, there is not enough money in the pot to actually make the difference, which is why families watching this morning are probably tearing their hair out, thinking that what you're saying sounds magnificent, but that is not what they are seeing day in, day out, as they are trying to find the best care for their loved ones.
No, and I totally get that, and I know that money has been under a huge amount of pressure in recent years. I mean, more recently, we have been putting a lot more money in social care, £3.6 billion this year. Local councils will have access to. We've already said, you know, the NHS long-term plan is getting up to £20 billion a year extra by 2022. So the money's now going in, but what you say is very important. It's about those budgets being pooled in the best interest of the individual. It's about the person being at the centre of the decision making, and about the different organisations not jealously guarding their own budgets and not putting that person's well-being and their needs first. And I think that's a culture change that we need to aspire to, and that's why when the NHS long-term plan and the adult social care green paper come out shortly, the fact that those two are coming out near to each other and need to interact with each other in the same way that when we care for people, we need to make sure that the money and the services wrap around those individuals as well.
Really appreciate your time this morning. I think we could have you on for about 15 more minutes. I'm sure there's many questions from those who are with us this morning as well. That's Caroline Dinenage, the Care Minister for England. Thank you for coming on the programme.